point for the point of view of different competitive exam such as GPAT, NIPAR and all. Also, it is very important point for UPSC drug inspector exam. So you have to focus on that and you have to understand it properly. I will not explain everything, but I will give you all the in-depth points, main important points which are normally asked in different competitive exam. Okay, so let's start. The first thing is Pharmacy Act passed in 1948. So you have to remember. Next second thing is that what are the rules and objectives? What are the rules and objectives of Pharmacy Act? So to raise the pharmacy profession in India, to provide the training to the pharmacy students, and to provide the registration certificate for the pharmacy students, to approve the most important point, to approve or renewal of the recognition of pharmacy educational institution, to provide the educational regulation to the educational institutions. The most important point here is that the Pharmacy Act passed in 1948. You have to remember Pharmacy Act passed in 1948. Okay. So what are the 5 different chapters present in the Pharmacy Act? The 5 different chapters are: in chapter 1, it contains introduction. It has again 2 sections, section 1, section 2. Chapter 2, Pharmacy Council of India, section 3 to 18. Okay. Chapter 3, State Pharmacy Council and Joint State Pharmacy Council. State Pharmacy Council is also denoted by SPC and Joint State Pharmacy Council is denoted by JSPC. Okay, and it has section 19 to 28. The chapter 2 has section 3 to 18 and chapter 1 has section 1 to 3. So section 1 to 3, 3 to 18, 19 to 28. And next in chapter 4 you will see chapter 4 is all about registration of pharmacy and it has the section 29 to 40. And the last chapter, that is chapter 5, it contains miscellaneous points and it contains the section of 41 to 50. The important section are section 3, section 14, section 15 and section 20. Also section 12. Section 3 is all about the Pharmacy Council of India, PCI or Central Council. Section 14 is about foreign applications. Section 12 is about course of study. Section 15 is about registration of pharmacist in the central level. So registration of pharmacist in central. And section 20 is interstate agreement. Section 20 is interstate agreement. So you have to remember these 5 sections. These are very important. Or how much section are there? Totally 50 sections. Out of that 50 section, these 5 section are very important and you have to remember that 5 section. So section 3 is about the appoint the PCI, that is Central Council. Okay, section 14, section 15, section 20 and section 12, you have to remember all these 5 sections. Okay, these 5 sections are very important. Apart from that, you have to remember which chapters contains how many section. Chapter 1 contains section 1 to 2. Chapter 2 contains section 3 to 18. One second please. Chapter 1 contains section 1 to 2. Chapter 2 contains section 3 to 18. Chapter 3 contains section 19 to 28 and chapter 4 contains section 29 to 40. Chapter 5 contains section 41 to 50. You have to remember this. Which chapter contains how many section? This is little bit important. Okay. Next, the Pharmacy Council of India. It was constituted in 1949. This is important. In 1949. Okay, it contains the president and vice president, constituted for every 5 years. Okay, elected and nominated members in the meeting session, consequently 3 times absent, that seat is vacant. Simply they can ask. So this is important, you have to remember, 3 times absent, consequently 3 times absent, so the seat is vacant. Okay. Next, the registration given in handwritten form to the president. It is not like typewriter or printable. It is the registration given is in handwritten form. These are the simple basic points, but you have to remember because they can ask questions from this. Okay. Next, PCI, Pharmacy Council of India. So there are three parts. One is elected members, one are nominated members, and one are ex officio members. These all these members are included in the PCI. Okay, they are totally, this PCI is constituted of elected members, nominated members, and ex officio members. In the last lecture, we have completed Drugs and Cosmetics Act 1940. In that also we have learned about the different wings. In that also we saw that ex officio members were there. Yes or no? Administrative wings also there. You have to remember the number of ex officio members, the number of administrative wing, and the number of all the three different types of wings. How many members are there in different wings? You have to remember that. This is very important. You have to remember. Okay. The next thing is that, see, in the PCI, the elected members, so 6 member elected, at least 4 members should be degree of diploma in pharmacy. 1 member elected from the MCI or NMC. MCI means Medical Council of India and NMC means National Medical Council. 1 member registered pharmacist from each state. From each state, you have to remember. So these all are elected members. Different, after that you will get nominated members. In nominated members, first 6 nominated member, at least 4 should be degree diploma in pharmacy. 1 member should be UGC on any university grants committee, and 1 member from AICTE. 1 member from 1 member registered pharmacist from any each state union territory. Each state or union territory. Union territory means some territory such as uh, DTAB, no, Boroland Territorial Area District, BTAD. BTAD, Boroland Territorial Area District. This is a different territory. Nagaland is a different territory. Like this, in northeast you will get so many territory areas. So from each territory, 1 member should be there, and this member should be registered pharmacist. So how many members elected? How many elected members? How many elected members? 6 member. At least 4 should be having diploma in pharmacy. 1 member elected from NCI, MCI, and 1 member from registered pharmacist. So how many members? 6 plus 2, 8 members. So you have to remember 8 elected members. Again, how many nominated members? See, 6 members nominated. 6 members nominated, at least 4 should be having degree such as diploma in pharmacy. 1 member should be having UGC undergraduate course. 1 member university grants committed, 1 member from AICTE, and 1 member from 1 member registered pharmacist from each state. So how many members? 6 member, 7 member, 8 member, 9 member. So how many nominated members? 9 nominated members. How many elected members? 8 elected members. So you have to remember 8 elected members, 9 nominated members, and how many ex officio members? See, Director General of the Health Services, Director Central Drug Laboratory Testing and Drugs, Drug Controller General of India. Drug Controller General of India, it is also denoted by DCGI, and this is very important. The full form of DCGI is asked once upon a time in the that competitive exams such as GPAT. Okay, so Director General of Health Service, Director of Central Drug Laboratory, and Drug Controller General of India. Okay, so you have to remember this. So PCI is all about these 3 members. 3 different types of member: elected member, nominated member, and ex officio members. How many elected? 8 members. How many nominated? 9 members. And how many ex officio members? So you have to remember that. Okay, next, PCI. Next, role and objectives of PCI. What are the different role and objective of PCI, Pharmacy Council of India? To frame the educational regulations. To frame the educational regulations, to approve the pharmacy course, to approve or removal of the recognition of educational institution, to provide lab facilities. So to provide lab facilities to the educational institutions, sorry, extremely sorry, there was a little bit disturbance. Wait. Okay, so to provide the lab facilities to the educational institutions, to provide the practical training to the pharmacy students. So these are the role of Pharmacy Council of India, PCI. Okay, and PCI also appoints the registrar and secretary, who is also act as a treasurer. Okay, but these points are not so important. The important points are the some tables I have created. These tables are very important. You have to remember that. See, in chapter 3, State Pharmacy Council and Joint State Pharmacy Council, Joint State Pharmacy Council is present between two or more states. Joint State Pharmacy Council is present between two or more states. They are such as Punjab, Haryana, so Chandigarh. The role of State Pharmacy Council and Joint State Pharmacy Council is registration of pharmacist includes the removal of names. Includes the removal of names. So we will see now the State Pharmacy Council and Joint State Pharmacy Council. In the case of State Pharmacy Council, elected members are 6 members. In the case of Joint State Pharmacy Council, elected members are 6 members. These 6 members elected from each state. 6 members elected from each state. 1 member from each state or union territory. And in the case of State Pharmacy Council, elected members, 6 members, they are possessing degree. Okay, and degrees such as diploma in pharmacy, and 1 member is registered pharmacist. So ultimately there should be 7 members. In State Pharmacy Council and in Joint State Pharmacy Councils, both should be having 7 members. Out of the 7 members, 6 members should be elected from each state, and 6 members should have diploma in pharmacy degree, and 1 member should be having registered pharmacy. 1 member should be registered pharmacist, that is, he should be having pharmacy registration. Okay, so nominated members, 5 members nominated, at least 3 should be having diploma degree. In the case of State Pharmacy Council, 5 nominated member, and in the case of State Pharmacy Council, 7 elected member and 5 nominated member. And in the case of Joint State Pharmacy Council, 7 elected members, but how many nominated members? Nominated member, 3 to 5 members nominated at least should be having degree such as diploma in the pharmacy from each state or union territory. Okay, next, ex officio members. Ex officio member, Chief Administrative Medical Officer, officer in charge of the Drug Controller of India, and government analyst. And in the case of Joint State Pharmacy Council, ex officio members, same for the Joint State Pharmacy Council for each state or union territory. Okay, next, chapter 4, registration of pharmacist. How many chapters are there? Total 5 chapters. How many chapters are there? 5 chapters. Already I mentioned earlier. See, chapter 1, chapter 2, chapter 3, 4, 5. Chapter 1 contains how many sections? 1 to 2. Chapter 2 contains how many sections? 3 to 18. Chapter 3 contains how many sections? 19 to 28. Chapter 4 contains how many sections? 29 to 40. And chapter 5 contains how many sections? Section 41 to 50. So you have to remember these are very important. Chapter 1, section 1 to 2. Chapter 2, section 3 to 18. Chapter 3, section 19 to 28. Chapter 4, section 29 to 40. And chapter 5, section 41 to 50. You have to remember that these are very important points. After that, you have to remember some important sections. Important sections such as section 3, section 14, 15, 20 and 12. In section 3, you will see appoint PCI and Central Council. In section 14, you will see the foreign application. In section 15, you will see the registration of the pharmacist in Central, and in section 20, you will see the interstate agreements. In section 12, you will see the course of study. Okay. Now, in the PCI, you have to remember the elected members. This is very important. How many elected members? 8 elected members. How many nominated members? 9 nominated members. And also you have to remember the number of ex officio members. And the most important point, who are the ex officio members? Such as Director General of the Health Service, Director of Central Drug Laboratory, and Drug Controller General of India, DCGI. So you have to remember these things. Okay. Here, out of 6 members, how many should have diploma? That is 4 should have diploma. And in the case of elected members, again out of 6 members, how many should have diploma? Again 4 members should have diploma. And how many should have PCI, that is pharmacy council? There should be registered pharmacist. How many? 1 member elected from MCI, and here also 1 member elected from UGC. 1 member elected from UGC, and see, 1 member should be registered pharmacist here. 1 member should be registered pharmacist. In the case of nominated member, again 1 member from AICTE and 1 member from each state or union territory, that should be registered pharmacist. So ultimately, one thing is common, that is 1 member should be registered pharmacist is common. Again, another thing is common. Out of 6 elected members, 4 members should be having diploma. Out of 6 elected members, 4 members should be having diploma. This is common. In the case of elected member and in the case of nominated member, one thing is extra, that is 1 member from AICTE. 1 member from AICTE. So this is the extra point only. Okay, one second. Next thing is, we will see, already we have seen about state pharmacy council and joint state pharmacy council. So what is the difference between state pharmacy council and joint state pharmacy council? In the case of state pharmacy council, this pharmacy council will be present in each state individually. But in the case of joint state pharmacy council, it will be present between 2 or more states. For example, for Assam, you will see an Assam Pharmacy Council. But in the case of Punjab and Haryana, you will see a joint state pharmacy council. Joint state pharmacy council is present between 2 or more states, such as in the case of Punjab and Haryana, you will see Chandigarh. In the case of Punjab and Haryana, you will see Chandigarh. Punjab and Haryana, you will see Chandigarh. So Chandigarh, in case of Chandigarh, you will see a joint state pharmacy council, and it will be acted between 2 states. They are joint, such as Punjab and Haryana. If you see in the northeast, again you will see in the case of Assam, you will see only 1 Assam Pharmacy Council. So this is the difference between state pharmacy council and joint state pharmacy council. But whenever you will see about the members of the pharmacy council, how many elected members should be present in state pharmacy council? Out of 6 members should be possessing 6 members should be possessing degrees such as diploma, and 1 member should be possessing registered pharmacy. 1 member should be registered pharmacist, and he should be having registration of pharmacy. Okay, 1 member. Again, in the case of joint state pharmacy council, same, 6 member elected from each state and 1 member from each state. This 1 member should be pharmacist, and this 6 member, they should be from each state. Okay, I forgot to mention one thing. When you will see the joint pharmacy council, see, in the case of state pharmacy council, only 6 members will be present. For example, I told you about northeast, like Assam. In the case of Assam pharmacy council, 6 members will be from Assam only. But in the case of joint state pharmacy council, 12 members will be there. Out of that 12 members, 6 members will be from one state and 6 members will be from another state. Why? Because it is joint pharmacy council. In that case, if you see the state pharmacy council of Chandigarh, you will see 2 states. One is Punjab, one is Haryana. So 6 members should be from Punjab and remaining 6 members should be from Haryana. Am I clear? Now, again you see, 1 member should be registered pharmacist from the same state. I took Assam Pharmacy Council. So in the case of Assam Pharmacy Council, 6 members should be from Assam and they should be having diploma. 1 member should be from Assam and he should be registered pharmacist. In the case of joint state pharmacy council, 6 members should be from each state. You have to focus on that term, each state. From each state, 6 members should be having diploma pharmacy, and 1 member also from each state should be having registered pharmacy. So again, each state means, in the case of joint state pharmacy council, there will be 14 members. Out of 14, 7. In the 7, 6 should be diploma and 1 should be RP, registered pharmacist, from one state. Again, remaining 6 should be diploma from another state and 1 should be registered pharmacist from the same other state. Am I clear? Okay. Now see nominated members. In the case of nominated members, 5 members nominated, at least 3 should be having diploma. In the case of nominated member in joint, 3 to 5 members should be nominated. At least 50% should possess degree of diploma in the pharmacy from each state. You have to remember that each state. Okay, next ex officio members. In the ex officio members, who will be there in ex officio members? They are chief administrative medical officer, officer in charge in the drug controller of India, and government analyst. In the case of joint state pharmacy council, same for the pharmacy council of each state, but there should be both the person from different states. Okay, but in the case of pharmacy council of India, PCI, who are the ex officio members? You have to remember this is very important. Who are the ex officio members? Director General of Health Service, Director General of the Drug Laboratory, and Drug Controller General of India. Okay na, so you have to remember these things. Next, chapter 4 about registration of pharmacist. In registration of pharmacist, during the independence, the government appointed during the independence, the government appointed one criminal for the registration pharmacist in India. Okay, 1 second please, 1 second. So during actually I had a call urgently, sorry. So registration of pharmacist, in the case during the independence, the government appointed one criminal for the registration pharmacist in India. The criminal consists of 3 members. They provided certain guidelines for entry of name in the first register. So what is first register? The person who possesses degree, diploma in pharmacy, eligible for registration. So according to government of India, during independence, who is the person who is the person who is eligible for the registration? So the first one who is eligible for registration is the person who possesses degree in or diploma in pharmacy. Who possesses degree or diploma in pharmacy is eligible for register. Or the person who possesses other than the degree, diploma in the pharmacy and must be compounding, see this is important, or must be compounding and dispensing of drugs at least for 3 years. So these 3 years is important. These 3 years is important in hospital or dispensary. So in dispensary, what is done? In dispensary only medicine dispensing is done. Okay, or in hospital also, but compounding is mainly done in different premises. They are pharmacy or any industry. Okay, so the first register, the person who possesses degree or diploma in pharmacy is eligible for registration, or the person who possesses other than the degree diploma, but he must be having compounding and dispensing of drug at least for 3 years in hospital or dispensary experience. Okay, this person is eligible for register. The person who passed compounder or dispenser exam conducted by the state government, he also write his name, so he is also eligible for the register. Or the person who is regularly compounding and dispensing of drugs in the hospital eligible for the registration. Ultimately, a person should be having experience in compounding and dispensing, or a person should be having diploma or degree in the pharmacy. The person who don't have the qualification but 5 years experience in compounding and dispensing, how many years? 5 years. 5 years experience in compounding and dispensing of medicine in the hospital or dispensary eligible for the registration. Okay. Next, subsequent register. After the education regulations, the government initiated subsequent register for the registration of the pharmacist. See, in that case, what will happen? The person must be possesses 18 years of age. The person must possess 18 years. The person must be of 18 years of age. The person must pass the Matriculation, the person must be resident of India, the person possesses pharmacy business in another state, or the person must pay or described fee for the registration. Okay, now you will see how many conditions are there. 4 to 5 conditions. The first condition, the person should be having 18 or more than 18 years of age. The next, the person should pass the matriculation. Next, the person should pass the matriculation. Next, the person must be the resident of India. If he is NRI, then in that case the condition is different, but the person must be the resident of India. The person possesses pharmacy business in another state, and the person must pay and describe fee for the registration. These are the 5 conditions for the subsequent register. You can take screenshot and you can revise later. Okay. Next, central register. In the case of central register, the central government maintain this register for all the registered pharmacists in India. Registered pharmacist. Who will maintain? The central government will maintain. Central government will maintain the register for all the registered pharmacists. The registration certificate is valid for 5 years. How much? Up to 5 years. Or up to December 31st of the annual year. Up to December 31st of the annual year. That's why what will happen? After the 31st December, a person should go to the Pharmacy Council of India or any state pharmacy council, and he has to renewal his certificate, that is license, and then again he can run his shop. Okay, 3 months grace period up to 31st March. This is the grace period, 31st March. And after the renewal, this license will have a validity of 5 years. After the renewal, the license will be having a validity of 5 years. In chapter 5, how many chapters are there? 5 chapters. In chapter 5, what we will see? There are different offenses, penalties. These are the miscellaneous important points. So in that case, the first thing is that the offenses and penalty for dispensing by unauthorized or unregistered person of pharmacist. The first conviction will be 500 rupees fine or 6 months of imprisonment jail. Second conviction, then 1000 rupees fine or 1 year imprisonment or jail. These points are very important in the point of view of drug inspector exam, so you have to remember that. In other second case, if a person is falsely claim the registration or certificate and he dispenses or he runs his shops or dispenses the drugs, then in the case of first conviction, he will have 500 fine along with that 6 month of 500 fine or 6 months of imprisonment. And in the case of second conviction, he will have 1000 rupees fine and along, or if 1000 rupees fine and 1 year of imprisonment, not and or. You have to mention that there is a huge difference between or and. So when it is and, 505 and 6 month imprisonment means the person has to pay 500 rupees fine, along with that he has to go to jail for 6 months. But if I'm mentioning the word or means the either the person will pay 500 or 1000 rupees fine, or he will be having 6 months of imprisonment, and in the case of second conviction he will be having 1 year of imprisonment. Okay, next is education regulation are amended in 19. These are the very important points I have written. You have to remember these points on the point of view of competitive exam. So education regulations are amended in 1953, 1972, 1981 and 1991. Okay. Next, according to education regulation in 1991, minimum of 250 hours the person must be dispensing drugs in hospital or dispensary for the patients, and maximum 500 hours of practical training of required for the registration of pharmacies in the case of graduates. So 500 hours of practical, you have to remember 500 hours of practical training, or 250 minimum 250 hours of person must be dispensing the drug into hospital or dispensary. This is according to the regulation of 1991. This is according to regulation of 1991. Okay, so you have to remember that. This is very important point. Next important point is that drugs and magic remedies. Drugs and magic remedies is different topics. We will learn that drugs and magic remedies in the next lecture. Now, the most important points For Pharmacy Act, I have completed. The question will be asked from these main points only. Now I am going to prepare another master key. In that I will provide all the main important points which will include all the questions. Like there will be no question asking out of that master key. We will revise only using that master key. Now we will learn using that notes. Okay. So up to this, Pharmacy Act was there. Pharmacy Act 1948. Okay. Later we will see that next topic, that is drugs and magic remedies, in the next lecture. Okay. Thank you for being connected with me, and thank you so much. All the very best for your upcoming exam. Okay.